There we go. All right, your 3 minutes perusal will start now. Okay, so your case starts now.
Hi, my name's Rebecca. I'm one of the doctors. What can you tell me about James?
So James is coming today with a productive cough he's had for the past 5 weeks. He's had increased shortness of breath in the past week. He noticed some blood in his sputum this morning.
Any fevers?
Yes, he's had temperatures on and off for the past few weeks.
And when is he short of breath?
He's short of breath pretty much all the time.
Does he wake up at night feeling short of breath, gasping for air?
He's short of breath through the night, but not waking up gasping, no.
Okay. And his cough, is it paroxysmal?
It's just all the time, basically.
Okay. Any sick contacts?
No, not that he knows.
Any recent travel?
Yeah, he's travelled to Papua New Guinea on numerous occasions. Nothing recent though, but he has stayed with family there for some time.
Any unintentional weight loss?
He's had 6 kilograms of weight loss in the past month with some reduced appetite and nausea.
Any night sweats?
He's had night sweats for the past month.
Any lymphadenopathy?
Not that he's aware of, no.
Okay. Any chest pain?
Yes, he's had some right-sided chest pain in the past week. He thought it was due to pulling a muscle from coughing.
Okay. Is it pleuritic?
It is pleuritic in nature,
And whereabouts is it?
just right-sided, generalised.
Does it radiate anywhere?
No radiation.
Any dizziness,
No.
nausea, diaphoresis?
He's had a little bit of nausea and he's had splits on and off for the past month.
Okay. And any orthopnea?
He gets short of breath, lying flat, yes, and with exertion.
Signs of heart failure, like peripheral edema?
No, no ankle swelling, no calf, leg pain,
And any palpitations?
no palpitations.
What's his past medical history?
He has polymyalgia rheumatica, which was diagnosed 6 months ago, and he is taking a reducing dose of prednisolone.
What's his current dose?
He is on 5 milligrams. He's on that for the past month. He's had good response to that treatment.
Any previous respiratory or cardiovascular history?
No.
Okay. Is his vaccinations up to date?
His vaccinations are up to date.
Did he get the BCG vaccine as a child?
No, he did not.
Is he a smoker?
He does smoke. He smokes 15 cigarettes a day.
How long for?
He has been smoking for 40 years. He has tried to quit a few times, but no real success.
Okay. His weight loss, could that be attributable to his diet? Does he eat well?
No, I mean, he's had some reduced appetite, but the weight loss is unintentional.
Okay. And we've got him listed as a non-drinker. Is that correct?
That's correct.
Okay. And does he identify as Indigenous?
Yes, he is a Torres Strait Islander, and he works in the local community in Cairns as an Indigenous artist.
Okay. Is he exposed to chemicals through his job?
No, just apart from those paints.
Okay. And in terms of age-related screening, has he done the bowel cancer screening program?
Yes, all normal.
Okay. And any other concerning symptoms on systems review?
No.
Okay. General appearance?
General appearance, he's a mildly overweight Indigenous male with mild respiratory distress.
Temperature?
38.7.
Heart rate?
Heart rate is 96 beats per minute.
It's 96.
96.
Blood pressure?
130 on 78.
Rest rate?
25 per minute.
25.
25, yes.
Okay. And
He's got
oxygen?
He's just got some mild respiratory distress, use of muscles.
Okay. And saturations?
94% on room air.
Okay. Cardiovascular exam?
He's normal.
Respiratory exam?
He's got tachypnea with the use of accessory muscles, showing some mild respiratory distress. He's got mildly reduced right-sided chest expansion, absent breath sounds at the right base, and a dull percussion note at the right base.
Any clubbing?
No.
And any wasting of the thenar muscles?
No.
Okay. ECG?
ECG is normal.
BSL?
BSL is 5.2.
Urine dipstick?
Is normal. NAD.
And I'm going to choose not to do spirometry at this point due to possible infectivity.
Yep.
Investigations, full blood count?
Hemoglobin 115 with a white cell count of 12.3 with elevated neutrophils at 9.4.
UNEs?
Normal.
LFTs,
normal.
sputum MCS,
Sputum MCS comes back showing microscopy shows acid pass bacilli. Culture grows Mycobacterium tuberculosis.
okay. Were there sensitivities on that as well?
Yep, sensitive to isoniazid and rifampicin.
Did we do a quantiferon gold?
We did a quantiferon gold and it came back positive.
Okay, and a chest x-ray.
Chest X-ray showed right-sided basal pleural effusion, clearly defined nodular opacity in the posterior segments of the upper lobes, with evidence of cavitation on the right.
Okay. All right, so at this point, my primary differential is TB with a secondary as being lung cancer. Other things could be other more weird and wonderful infections causing cavitation. So Staph aureus, fungal like Aspergillus, melioidosis, one of those, but primary is TB or lung cancer. So based on that, he needs an urgent referral to an ID physician and or a respiratory physician. He needs to have some education about TB and what that means, and that he's at risk of giving this infection to other people. And so he should wear a mask and avoid contact with anyone who's not his close household contacts. His close household contacts also will need testing as well. Of he'll be put on a long course of antibiotics, likely 6 months, with isoniazid and rifampicin forming part of that. And that will be directed by the ID physician and monitored by us.
Okay. Is there anything else investigation-wise you would do if the diagnosis wasn't as clear, I suppose?
You do a CT test?
Yeah. So a high-resolution CT test confirmed the diagnosis of pulmonary TB. That'll help rule out lung cancer as well. Yeah. What other things, given that he's an Indigenous patient, would you consider doing?
So he needs cardiovascular risk assessment given his age. So you could do lipids as well for him.
Yep.
24-hour ambulatory blood pressure, although today's blood pressure was reasonable.
Yep.
He needs extra vaccinations as well. So we could give him a pneumococcal vaccine today, given that he now has a chronic lung disease as well. He should have annual flu vaccines.
Yep.
Any medications could be through the Closing the Gap program as well. He can have a health assessment for his overall health through a 715 item number.
Yep. Okay.
Engagement of Indigenous health worker if he felt like he wanted that.
Okay. That's excellent. Thank you. All right. Another big case. It's a lot to get through in 8 minutes, isn't it?
Yeah.
It really becomes difficult to get through all of that in 8 minutes. And that's why just practice the timings. It's just smashing out, like a machine gun, just snapping out what you want. I think this case in particular, there's a lot because it's Indigenous to that you could cover. But yeah, you certainly covered all of the relevant things quite easily. Once again, I think I've said it in our training sessions. If there's a lot of things to cover, you're better off saying, look, if you're a smoker. I mean, the main things you're treating your TB, but you're a smoker. We want to, look at your lipids. We want to look at all those things, and before you get too carried away with managing TB and run out of time. So that way, if you get time, obviously go back and expand on them. But by listing all of it, it gets you, at least I know that you were thinking of it. When the bell goes in the old OSCE, they would just say thank you, grab a bit of paper, and you just walk out the door. So if you hadn't mentioned, 3 things, it wasn't obvious that you would ever get around to talking about them. So that's what I would suggest. Like in your management section, write down what things you would want to cover, and just list them off. There's 5 things I want to talk to you about. We may not have time to do that today, but these are the 5 things. Of them, this is the most important. We're going to deal with this today. If I don't get time to come back to the other things, I'll get you back next week and do that. So in that sort of, 10, 15 seconds, you've covered all of management, and then you can expand on it. But as we've found with these cases, if you don't get the history done quickly enough, you'll run out of time. So and if you'd have said, these are your management problems, this is how I'm going to manage it. If I can't get into telling you everything today, I'll get you back, in a couple of days, and we'll go through it in more detail. Then that's adequate. Whereas, as I said, if you start talking about how you're going to manage, the pulmonary TB down to the minutiae and run out, then you haven't spoken about smoking cessation. You haven't spoken about, in this case, there wasn't a hell of a lot more. But as you said, we need to make sure that he's covered the rest of the risk, because he's an elderly Aboriginal smoker. So, yeah. Anyway.
Yeah.
Excellent. Well done.